Hi, my name is Dr. Michael Corey, and I want to welcome you to the special presentation. Today we're going to be talking to you about the introduction to metabolic testing, functional neurology, and functional nutrition for the autoimmune patient. Now, when I talk about autoimmunity, you probably have a loved one or a neighbor that's currently suffering from an autoimmune condition right now. We're talking about things like rheumatoid arthritis. We're talking about lupus, Sjögren's syndrome, multiple sclerosis, Hashimoto's thyroiditis, and it might have been diagnosed as hypothyroidism. The majority of cases are misdiagnosed. So what we want to do is we want to talk to you about what the causes are. But without further ado, I want to just kind of introduce myself. I'm Dr. Michael Corey, and I've been in practice for over 22 years. And I've been taking care of these conditions for the last 10 to 12 years because I saw that a smaller population of my patients were just not getting better the way that they should. And I knew that there was an underlying cause to this. And these autoimmune conditions are very, very often not diagnosed properly. So what we want to do is we want to make sure that we do as much as we can for each and every patient so that we can help them regain their health and vitality again and lead that optimal living that they deserve. Now, I've also taken coursework. I'm board certified in integrative medicine. I'm a graduate of the American Functional Neurology Institute and a practitioner of diagnostic and therapeutic bioresonance toxicology. So what that means is we're going to take a multiple prong approach towards helping patients with autoimmune conditions. We want to make sure that they get the fuel, the activation, and decrease toxicity in their body and in their life so that they can sustain an optimal immune system. We will have to stop those triggers of what's causing autoimmunity. Now, autoimmunity, the big picture of this is that parts of your immune system aren't working properly. We have some areas that are working excessively hard, and we have other areas that have dropped in function so that your body is not auto-regulated. We take it for granted sometimes when we experience great health because there's no symptoms. We feel like our body's on autopilot, and that's exactly how it should run. It should run on autopilot as long as you take care of it and give it what it needs. Now, when we talk about autoimmunity, one autoimmunity is autoimmunity. And what I mean by that is that it can affect different tissues. So when we look at different tissues, like those conditions that I just mentioned, the Hashimoto's, the rheumatoid arthritis, the Sjögren's syndrome, the lupus, all of these are autoimmune. Your body is attacking those tissues. If you have an autoimmune condition, you probably have multiple. It's very, very uncommon for you not to have multiple tissues being destroyed at the same time when you're autoimmune. It's just that for the most part you've been diagnosed with one because one has excessively taken over your life. Could be with your thyroid, which is very, very common, or the lupus, or the rheumatoid arthritis. But you notice many of these conditions don't occur when we're in our teens or even in our 20s. Sometimes they do with more interference or more toxins that have been present in that person's life. But if you are autoimmune against one tissue, you're probably autoimmune against multiple tissues. And for that reason, we use Cyrex labs to identify the tissues involved with their 96 tissue antibody test. Now, there is no cure for autoimmunity. It's important for us to identify those triggers so that we can take care of the destruction of your tissues. Now, from an autoimmune disease standpoint and statistics, we have autoimmunity increasing year after year throughout the United States. In most cases are not diagnosed because our current healthcare system and the doctors are giving you symptomatic care. Symptomatic care is not going to help you other than on the short term. It's going to actually cause a progression of your disease process, and you're going to need more and more medications to handle those symptoms. So we want to get to the root cause of why you are experiencing this destruction of your tissue through autoimmunity. Now, most cases continue to progress if you don't get to the core triggers of what's causing it. And that's exactly what we do in our office. Conventional healthcare has very little to offer besides steroids. Now, steroids will decrease inflammation, but it's going to destroy tissue over time, and it's never going to get to the source, so your underlying condition is going to continue to progress. This all leads to tissue destruction as things continue to progress if we don't take care of these causes. Now, autoimmune conditions include our healthy tissues in our body making autoantibodies, and it's not distinguishing between self and abnormal self, okay, or non-self. So your body's going through and it's destroying healthy tissue. And that's very, very important for you to understand. So we want to talk about autoimmune physiology. We have some natural barriers in our body that we utilize and that we depend on every day to provide us with optimal function and health. Our skin, biggest detox organ in our body is our skin. Our lungs, our eyes, the mucus, respiratory tract will get trapped pathogens within the respiratory tract affecting the lungs, affecting all of our tissues and organs. The gut flora has to compete for these abnormal bad bacteria that's in the gut, or pathogens such as heavy metals, yeast, mold. All of these can play an integral part in getting one of our patients well when we treat the autoimmunity in our office. And your white blood cells are vital because that's your immune system. When we go through and we look at your blood panel, we want to look at each and every fraction of the white blood cells to see how your body is responding. Now there's two parts to your immune system, Th1 and Th2. When a person is autoimmune, one of these systems is hyperfiring and one is hypofiring. So the teeter-totter is not balanced. We want to make sure that we go through and we balance that out by regulating cytokine activity and decreasing inflammation in your nervous system and immune system. So with dysregulation, the immune system is imbalanced because it's being stressed. And we can be stressed with the autoimmune system because of chronic inflammation due to a poor diet, what we call the standard American diet. I'll go into more detail with the standard American diet on another video. So by all means, check out my YouTube channel, and I have a lot of videos on there regarding food and nutrition. Bad blood sugar, so our glucose levels are out. If your A1C is off, then you're even more susceptible because your blood sugar regulations causing problems with every tissue in your body. Bad adrenal glands. Well, if you're fatigued and you just can't get out of bed in the morning, or you fall off halfway through the day and you just feel like you have to take a nap every day, then we probably have an adrenal gland problem. Hormone imbalances. Now I see this quite often, and from a hormone standpoint, we will do a hormone panel. We want to check the testosterone, we want to check the estrogen, the estradiol. We want to go through and check each and every one of those factors in checking with an autoimmune patient that's experiencing these problems. Neurological imbalances. Well, let's just talk about that briefly. Your brain should be balanced and everything should be working. We should have equal stimulation reaching from the joints and muscles and tissues and receptors of your body up to the brain and back down again, and auto-regulation, so everything self-perpetuates its function to its highest degree. Pregnancy can cause havoc with hormones, so very often we do see that this can be an initiator as far as with an autoimmune patient. But low vitamin D levels. So these are all stressors. And what we want to do is we want to make sure that we take the stress off the nervous system and immune system and get you working at your very best. Now, we have active antigens that can cause this as well. So from a trigger standpoint, the immune system is imbalanced due to an invader of your immune system. What I mean by this is that we can have chronic infections, bacteria, virus, mold, heavy metals, infections in the gut, food sensitivities. Okay, this is huge stuff. I want you to pay attention because we are not eating the same food today that we did 50 years ago. Everything that we have in the grocery store without being labeled properly is genetically modified. We're having bacteria and virus and antibiotics distributed through our meat products, our vegetables, and the food that we're taking in as nutrients. So now autoimmunity is a metabolic problem involving multiple bodily systems. And what I mean by that is that when we eat food, we want the carbohydrates, the proteins, and the fats to be disseminated, utilized in our body, and we want to excrete waste. But when we take those foods in, we produce energy. And energy is the source of everything that we have in our nervous system and immune system. Everything that regulates everything in our body comes back to those. Now, what percent of energy goes, 90%, it should say 90%, 90% of our energy goes to what system? Is it the endocrine system, the digestive system, nervous system, immune system, or cardiovascular system? And the answer to that is the nervous system. The nervous system includes your brain, the spinal cord, and the nerves going to every muscle, cell, and tissue of your body. So our take-home message for you with this is if you have a metabolic problem, your brain will not work right because your brain is the most metabolically active organ in the human body. And we want to make sure that we take care of that. So when you have brain fatigue and misfiring, it produces an imbalance, gives us symptoms. Our brain-body connection includes the sensory organs, everything you perceive from the brain. When wind blows on you, when you taste something, when you touch something. Our body also has, and its most important is its ability to resist gravitational forces, which allow us to come up from the ground and stand up and hold our structure strong. But we have receptors everywhere. Muscles, joints, skin, eyes, ears, nose, and mouth. All of these areas have to function at their very best. Now, I did have a question on this previous one, which two receptors light up the brain the most? And the answer to that one was touch and gravity. So super, super important, and I'll do special testing with you for checking your sensory system when you come in the office for an evaluation. We have 3 parts to the brain, and these parts are very important. We're looking at the cerebellum. At that point, then we look at the cerebrum. We know that is the brain itself. And we have, on the bottom, we have the brainstem. So all of these areas have to light up. We have to get proper stimulation to them. Okay, brainstem's firing up. And so the brain works from its sensory input to the body, which goes to the same side of the cerebellum. So everything on that right side will go up to the cerebellum, and it's sent to the opposite side of the brain. So everything comes back from your body, comes up to the cerebellum, comes back up to the opposite side of the cortex from a sensory standpoint. The brainstem inhibits or puts a brakes on the control system of our sympathetic nervous system. When somebody has palpitations or they have anxiety, that immune system, that nervous system is not being inhibited. So the biggest job of that area of the brain is putting the brakes and slowing things down so things can work. If you have diarrhea, it's overactivity. Your brain is firing at such a rate that the digestive system isn't slowing down to replenish and provide nutrients to your body and to its tissues. So without the brakes of our sympathetic nervous system, a lot of chronic conditions will occur. The cerebellum, the cortex or the brain, and then the brain stem. Super, super important. And these are parts that I work with as a chiropractor on a day-to-day basis. Your adjustments and the spinal alignment will stimulate these either properly or improperly, either creating a balance between the left and right hemisphere or an imbalance where we're getting overfiring on one side and not on the other. Now, an overfiring sympathetic nervous system can cause things like chronic pain and chronic fatigue, irritable bowel syndrome, urinary tract infections, fibromyalgia, migraine, tension headaches, and also poor posture and adrenal gland stimulation. So we want to make sure that we take care of this overfiring. It can also cause blurred vision, increased sweating, difficulty falling or staying asleep, insomnia, dizziness and vertigo, heart palpitations, as I mentioned. We can also have issues as far as with cold hands and cold feet because your body is not stimulating the distal extremities, so your hands and feet don't get the circulation that they need. We lose blood supply. And sensitivity to light and sound. Now, when we get to cerebellum fatigue, we get loss of balance, we get vertigo, we get chronic neck and back pain, we get headaches, clumsiness, you might drop things on a regular basis, disorganized thinking, and a lack of output to the upper brain, the frontal, parietal, and temporal lobes, which is your eyes, your ears, your nose, and your throat, your vestibular system to keep your balance. All of these systems are affected. Now, cerebellum fatigue, as I mentioned, will come back and affect those 3 areas once again. Now, let's get that slide to change. There we are. The frontal, parietal, and temporal lobes results in a lack of inhibition of the sympathetic nervous system. It puts you into a fight or flight mechanism. You know, when you're running and we want blood to go out to the arms and to the legs and away from the gut tissue, when you're sleeping, we want the stimulation to come back into the gut for replenishment of nutrients, sleep, and repair. So your body is a miraculous structure and function, and we take these things for granted. Now, upper brainstem fatigue can cause depression, anxiety, difficulty scanning pages while reading, difficulty adding or subtracting, difficulty with verbal expression, difficulty understanding language, decreased memory, learning difficulties, and a lack of focus. So ladies and gentlemen, how many of these symptoms are your loved ones experiencing today? It's super, super important. We want to take care of the whole body. We can do that for you here in our office. Upper brain fatigue can also cause altered sensation, numbness and tingling, changes in your handwriting, anger, and with increased irritability, or you become a little bit more impulsive. We can have body weakness, strength loss on one side of the body or another, lack of motivation, learning disabilities, dyslexia, ADD, ADHD. There isn't a condition of autism, ADD, ADHD that I've seen in the office where there was not a metabolic component to that patient's suffering. So we want to make sure we take care of these things. How does this happen? It happens through stresses. The chemical stress, the physical stress, the emotional stress causes the brain to fatigue, and we get fewer new nerve impulses and fewer stimulation to that cerebellum, brainstem, and cortex of the brain. And we want fuel and activation to occur properly. Now we have chemical, physical, and stress to the brain. We can have anemia, blood sugar imbalances, food sensitivities such as gluten, casein, which is your dairy, soy, and other food allergies. Immune system imbalance, an autoimmune response, poor diet, the inflammation, decreased omega-3s, higher omega-6s, we need to watch the fatty acids, hypothyroid function, prescription, non-prescription drugs, chronic inflammation, and hidden infections in the gut. Now these are all metabolic problems that create the nervous system to become imbalanced, affecting the brain. And that's why it's so devastating. We have to take care of this. Everybody should be taking care of themselves in the way that I'm going to be talking about. Emotional stress to the brain, adrenal gland disorders, cortisol imbalances, anti-insulin effect on tissues, raises blood pressure too high, high triglycerides, LDL, and cholesterol. These are all dietary things. And you know, when you go to the doctor, they give you pharmaceutical medication. Let food be thy medicine. So I think that's a quote from Socrates. High insulin and glucose levels cause breakdown in your brain and nerves. So we have to understand, we have to keep the blood sugar regulated. Now, the cerebellum and brain require two things to function, and I mentioned these to you earlier. We've got fuel over here, and we've got activation over here. Now, we need to make sure that you are staying up and active. We don't want you laying down on a regular basis, because remember, the number one input to the brain is gravitational forces. We need to keep you upright so your body can actually auto-regulate and keep that nervous system working good. And we got the fuel, good glucose, good blood sugar, normal, 85 to 100. We need proper oxygen to be carried throughout that blood to your brain. You know, try to hold your breath for over 30 seconds and you're going to start to get weak and you're not going to think clearly, and eventually your body's going to say, okay, it's time to breathe again, because it's not getting its vital necessities to life. Now, have you been told your lab tests are normal, but you're still experiencing symptoms? Lab ranges are inaccurate. We need to use a bell-shaped curve, and we need functional lab values which are more sensitive to reveal the true problems and variances. So this is why your lab test is normal, but you still feel horrible. We can have abnormally low values on one side, and we'll have abnormally high values on the other. You have to understand these labs, that when you go to a lab, there's actually an average of all the patients that have been to that lab for the past year. So you can have a different variance between LA and San Diego, or San Diego and New York. Throughout the country, these are different averages. They will be similar, but they are going to vary from lab to lab. So why don't we have an optimal value? How come we don't see a optimal? Where do I need to be? Where is that sweet spot that I can keep my blood regulated when I look at those lab tests? Well, I'm going to talk to you about that, because we call those functional lab ranges. So in these areas you will find lab findings that the doctor will say are normal, but they're actually not, because they're out of an optimal range. Super, super important to look at this. When we look at glucose, 85 to 100 is your functional range, 65 to 110 is the traditional lab value, and if we have a lab value on your test that comes back at 73, you are actually hypoglycemic. You actually have a decrease in your blood sugar level. TSH is 1.8 to 3.0. If your lab value is 0.3 to 5.7, as your doctor has read that as a normal range, and you're 4.2, you have hypothyroidism. Okay? We're out of an optimal range. We want to get that in. And that goes true for every single one of your other blood tests that we see. So let's take a peek at that. And so based on your history, we will make or run some of the following tests and look at functional values. We want to do a complete blood chemistry panel. We want to include your thyroid markers, your A1C, your lipids, your CBC, your complete blood chemistry with auto differential, looking at the anemia or other infections that might be present in your body, saliva hormone testing, your salivary tests looking at all the adrenal hormones, including cortisol. When cortisol goes up, we have havoc on the immune system. Stool ecology profile to see if you have poor gut flora, infection, or parasites within your nervous system. And then, the gastrointestinal system in the gut. And we want to use Cyrex labs for the testing. We'll check you for food sensitivity to gluten and multiple other foods. We'll check you for leaky gut syndrome. And we'll also look at autoimmune testing to include measurement to see if your immune system is mistakenly attacking over 90 different types of tissues in the body. Now, what makes our office different than every other office that you might visit with? Well, we treat patients structurally, neurologically, and metabolically. We have a three-pronged approach that we're going to look at. We have to have all three of those prongs working as close to 100% or optimally for you to experience optimal great health. You know, nothing gives me more pleasure than seeing people who had so much suffering in their life to blossom. No different than a plant on your patio that you start to give proper nutrients, proper sunshine, and proper water to, the ingredients for health for that plant. We want to do the same for you. So I'm here to tell you that no stone will be left unturned to determine the exact cause of your condition. Now, on a scale from 1 to 10, how serious are you about taking care of your illness or your condition? How has it affected your relationships, your work, your ability to enjoy your life? On a scale from 1 to 10, how serious are you about eliminating this condition? Correcting the underlying causes, identifying the triggers, and living a new life from what you're used to at this point. Due to time constraints, I can only accept those who are truly committed to getting well. Now, I do thank you, and if you have any questions, by all means, I'd like you to email me. I have an email address at askdrcorey, ASKDRCOREY, at wellnessstop.com. There's 3 S's. Askdrcorey at wellnessstop.com. I will answer your emails. If you have any questions, more than happy to give you a telephone consultation at no charge if you would like to talk to me about your condition prior to making an appointment. I thank you from the bottom of my heart. I'm here to help you. And God bless you, and I look forward to you living the life that you deserve. Thank you.